Hey Central Virginia, this is Dr. Keith Lynch. We're going to talk about our chronic knee solutions today and how we help people with chronic knee pain. Now, I've been in private practice here in Central Virginia since 1998, and I've been successfully using cold laser in my practice since 2006, and that's just been fantastic. However, in 2013, we decided to go ahead and get the MR4, the super pulsed laser, because I felt that it had more power and went deeper into a larger joint like the knee, because we wanted to get the best results we could possibly get for our knee pain patients. And I've got to tell you, that's been working out great, and that's what we're going to talk about today. Now, our program consists of several different parts. It's not just one thing. It's not just cold laser. So let me explain how we go through our program so that it makes more sense. The first thing that I want you to understand and take away from this is that there are other options besides medication, besides surgery, even if it's bone on bone, even if you've already had knee surgery or had a knee replacement. There are other options for you, because not all replacements work. They're going to work somewhat, or they're going to wear out at some point. It's not a simple surgery. So you've got to keep that in mind. There's a high risk of infection, and if it wears out, where are you going to be? Most of my patients that go to orthopedic surgeons, the surgeons basically say this. They say, try or do anything you can before you need to have surgery. And that's part of what this program is. It's a get your knees back so you don't need surgery. Because even if you do get surgery, this report is from the Washington Post, Tuesday, January 7th, 2014. And basically what this is saying is that they did a study of all these people with knee surgery, and some people, they gave the arthroscopic surgery and went in and trimmed up the cartilage, and other people got what they called a fake or a sham knee surgery. And guess what? After 12 months, the results were the same for both groups. So that doesn't really give you a lot of confidence that, boy, I'm going to get knee surgery. It's going to be like driving out of here in a new car. Unfortunately, it doesn't really work out that way. And that's how I started this program, by helping people that had had knee surgery. When the knee pain came back, guess what? They came to me, and that's how we got them well. So let's talk about what we do during our examination, because that's really important to understand. Now, besides the nerves that actually transmit the pain messages up to the brain, what do we have around that joint? Well, around those bones, you've got muscles, tendons, ligaments, and cartilage. Now, the tendons are what attach muscle to bone. Ligaments are what attach bone to other bones. And then the cartilage is the padding in between the knees, often called meniscus, or plural menisci. So those are the tissues around that knee joint that we're going to be evaluating when you say, well, it hurts around here, and you're pointing to that area. So we're going to do orthopedic tests to stress those areas, because that will isolate and tell us what's happening. So just to give you a brief example of that, if I lift and move your leg and you're doing absolutely nothing, that would be passive range of motion. Passive range of motion identifies whether or not there's a problem with the ligaments. If I'm just pressing and you're going, ow, 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 that hurts when you move it like that, it's probably a ligament that's damaged or injured. If I tell you to hold strong and I'm pulling on it and then it's causing pain in different areas, that would be a muscle, or it would be a tendon. Or if we compress that joint or take it and kind of put a torsional stress into it, and you point, go deep inside the joint, it hurts, that's the meniscus. That's how we know where the problems are, because it's important to identify what's actually causing the pain and the problems that you're feeling. How about this one? I get this so often, it drives me crazy. People come in and they go, it hurts when I'm sleeping. I can't sleep through the night. It wakes me because I'm in pain. And I say, well, what have you found out so far? And they say, well, the doctor took an x-ray and he believes it's bone on bone. I work with the spine all the time in chiropractic, and I see bone on bone very frequently. And bone on bone pain increases when you're on it, and when you get off of it, it decreases. That's what's actually causing the pain. If it's not weight bearing, it probably doesn't have to do with the joint. Now, if you're having this pain, the good news is we're more than likely able to help you. Two things to think about. Number one, the popliteus muscle goes across the back of your knee. It's the muscle that unlocks that knee. And if there's a problem with the popliteus muscle, either it's got scar tissue adhesions in it or the nerves aren't working right that go to that muscle, you're going to have weakness in that muscle. But it's not going to feel like weakness to you. It's going to feel short, tight, achy, kind of like a toothache going across that knee joint. We have techniques to help release that, and we'll talk about that a little bit later. What else can cause pain while you're sleeping at night in through the knee? Well, that has to do with your large diameter afferent nerves. Remember, we said nerves are what bring the information up to the brain. Well, you've got two different sets of nerves in that area. One of them are your small diameter afferent nerves. They bring pain and temperature up to the brain. I don't have to tell you, you already know those are going to be working fine because you're feeling pain, even at night. But what about these nerves? Large diameter afferent nerves have to do with the pain inhibitory pathway. So how do you test these? Checking for light touch, checking for vibration sense, joint position sense, drag. Those are the types of sensations that patients typically lose in their lower extremities when the large diameter afferent nerves aren't working right. Typically that can happen due to inflammation in and around that area so that the blood supply going to the large diameter afferent nerves gets decreased, and it decreases to the point where the nerve stops working. And that causes a loss of function of these nerves, and then the only nerves that are unchallenged sending information up to the brain are your small diameter afferents or your pain fibers. And you will have an uninterrupted stream of bad information of pain going up to the brain. And it'll probably be a little bit better when you're out and you're walking around, you're moving, you're doing things, and you'll say, yeah, but once I sit down at night or I lay down at night, it's just like the pain goes up, I can't sleep, it's terrible. That's a large diameter afferent nerve, and we have to heal those to get that area working right. Now the good news is we've got great technology in our office to help improve the function of that pain inhibitory pathway. Let's start with talking about the MR4 cold laser, which I introduced earlier. This is a great tool for helping people that have pain. So what it actually can do is it promotes healing by stimulating the fibroblasts. Now most people say, well, you know, I'm 50, I'm 60, I'm 70 years old, the doctor says it's bone on bone. You know, what are we going to do about that? Well, the fibroblasts are the things that actually create the building blocks. That's the actual building up of cells in your body. But I might be getting ahead of myself. What you need to remember when I'm talking about this is that your body is constantly breaking down the material in the body, called catabolism, and it's rebuilding those cells. So every 6 months, you've got new cells in an area. I think it's every 2 years you have a brand new heart. So you need to realize that if you're doing everything right, you can actually be healing an area, not continually breaking it down. But everything in that area needs to be working right, and you need to have the tools to stimulate healing. And that's what the MR4 super pulse cold laser can do for us. It also increases metabolic activity, making enzyme reactions work better and work faster. That also stimulates that healing process. It also reduces the formation of scar tissue. And we'll talk more about scar tissue in just a couple slides. It also reduces the swelling and inflammation present. Now that's really important because let's say somebody gets a black eye. It's not tissue damage that's causing the pain. It's the swelling and inflammation that's pressing on all those pain fibers in that area, sending information up to the brain. That's why when the swelling goes away, the pain goes away too. When you have damaged knee tissue, it creates swelling and inflammation, and that prevents oxygen and nutrients from getting into those cells, and it prevents the debris that's broken down in that area from getting out. So using the MR4 cold laser, it actually increases circulation through an area. So we are getting the blood, oxygen, and nutrients into the damaged tissue so it can rebuild and heal and pump out the inflammation that's causing pain. Whenever we're working with nerves, any nerves, there's two things that that nerve needs so that it can survive and it can improve. And one is fuel delivery and two is activation. Fuel comes in the form of ATP. That's the chemical energy that actually allows your cells to work better. And when you use cold laser on an area, you're increasing the amount of ATP available to those cells. That's going to speed up healing. That's going to give you that fuel delivery that you need. And then we use Hacomed. It's a form of horizontal microcurrent. And I got to tell you, this has been a game changer. This is like a $25,000 unit that we use, and we use it to help nerves heal. And it just has been making great improvements. I know we're talking about our knee pain program, but if you've ever heard of a condition of peripheral neuropathy where it causes pain in the feet, this instrument along with the cold laser has been phenomenal in reducing that. And the reason I point that out is because down in that area, it's all nerve involved. You don't typically see breakdown of the joint with peripheral neuropathy. It's a straight on, this is the nerves, the pain inhibitory pathway, it just flat out doesn't work anymore. So what this does is that Hacomed works at a deep level to the nerves to give them that activation that we talked about and also improve the blood flow to those nerves. Because with electrical stimulation at the right frequencies, we can actually block pain. Now that's an important concept because when somebody has pain, you want to start blocking that pain right away. And we can do that without medication, without surgery. We can do it with the right type of electrical stimulation. And that will activate those large diameter afferent nerves. So we talked earlier about that pain inhibitory pathway. That's what these nerves are all about. So give me an example of that, right? How about you're walking at night and it's dark and you're on your way to the restroom or back from the restroom. You get close to the bed and wham, you whack your toe up against the bed frame. Immediately, your knee-jerk reaction is going to be to reach down and grab that painful toe. And the reason for that is this. Small diameter afferent nerves, or pain fibers, send information to the brain at a certain speed. Large diameter afferents are much faster. They send information up to the brain at about 270 miles per hour. They are also very metabolically demanding, which means if you start to lose function, you will see loss of your pain inhibitory pathway. So once you kick that bed frame, you're going to immediately go down and grab that foot with your hands. And what are you going to do with it? You're going to hold it, you're going to rub it, you're going to move it around. Light touch, joint position sense, drag or vibration on the skin. By doing those, you're stimulating the large diameter afferent nerves. That information is going to shoot up to the brain faster than the pain pathway, and guess what? You're going to feel less pain. I dare you, the next time you whack something or you drop something on your hand or your foot, to not touch it. Don't touch it. Wait like 30 seconds and kind of get a gauge of how much it hurts, and then go down and grab it and rub it and move it around. You'll see that pain drop off to about 50% in seconds. This is natural. This is how it works. It's just how the brain works. So the neurology of it is what we're actually trying to improve, that pain inhibitory pathway, because if that's working right, you're going to do better. Now, the HacoMed microcurrent also increases metabolic activity, so it creates a pumping action to help pump out the inflammation and pump in oxygen and nutrients. So once again, we're using cold laser and the microcurrent to increase improved nerve function and cell function. So we're getting the garbage or the debris out of there, and we're getting blood oxygen and nutrients to go back in. So we're stimulating the nerves and we're giving them fuel along with that. And that's why this can be such a powerful 1-2 punch when we do this. But why would you stop there, right? Everybody's heard of scar tissue. If you go in for surgery, they'll tell you, there was all this debris, we got rid of that. There was scar tissue everywhere, we cleaned up some of that. I got to tell you, when you have surgery, one of the things that you're going to be left with afterwards is a scar. Or if you're getting arthroscopic surgery, you're going to have 3 scars on the outer surface of your skin. But I want you to know, those aren't the only scars you have, because that instrument is going inside that joint and it's cutting through other things. And each one of those things that it goes through, it's going to leave scar tissue there. So even after surgery, there's going to be scar tissue. But what if I said there was a way to reduce scar tissue naturally from the outside? We do that with a percussion instrument. So to you, it's going to feel like a massaging tool. Most of my patients are like, wow, that feels good. I beg you to stop in about a half hour. It doesn't take that long. It just takes a couple minutes. But it feels good when you do it. But I got to tell you, it's not really a massaging unit. It's a hammer. And what that percussion unit does is it goes out about 1/4 of an inch excursion, and it does it so fast that it looks like it's sitting still. But you can put your hand up, you can feel it, you'll see it feels actually really good, because scar tissue can be a key component. Reducing that is going to help your range of motion, it's going to help you heal, and it's going to improve your knee function. Because adhesions in and around that knee can spread, it can cause pain, it can cause numbness, and it can limit your range of motion. And those are the areas that we really want to see you do better in. So if you have pain and it's just like a general pain in and around that knee, it can't just be coming from being bone on bone. It's got to be a multifaceted issue. And I'll tell you, the reason that I have so many of these things that I do, the scar release, the HacoMed microcurrent, the cold laser, the reason we do that is because there are so many structures in the knee that can get compromised over time, and we've got to do everything we can to heal it